We are here at Performance Medicine in Kingsport talking today about pain management. We are here with our daytime doc, Dr. Tom Rogers, and certainly this is something we continue to hear a lot about.
Well, it's big in the news because the CDC has just announced that 2014 was the worst year for addiction to pain medications. There were 19,000 deaths from prescription opioid medications, and over 200 million prescriptions were written by physicians for opiates like Lortab and Vicodin and Percocet. So this is a major crisis. We're overprescribing pain medications. People are getting addicted, and then they're ending up on heroin. So, you know, we kind of have a pain management system here that's non-narcotic. In my mind, we have the perfect team. We have Ernie Dickson, a physical therapist who's been doing this for 30 years, evaluation of musculoskeletal pain, acute and chronic. And we have Dr. Harshbarger, pharmacist who does a ton of compounding with pain gels that we've used for years. So I want to introduce them, and I feel like we've got a good team for people to come in and get evaluated without using narcotics for this pain that we have.
And certainly, Ernie, we know that you deal with patients over the years, and you're starting to see the benefits, and they feel that pain relief without having to turn that other direction.
They sure are, Amy. And the key to it is having a good musculoskeletal evaluation, and that way you can help determine what the cause of pain is. Some people have acute pain, which is caused maybe due to trauma or a recent accident. Some people have chronic pain that's been going on for a number of years. But the key is if you can kind of evaluate it and see what's going on there, then you can find a plan of care. And usually, you know, like things that we do that help with pain is things like using modalities, things like using moist heat, ice, ultrasound, e-stim, you know, also using some microcurrent or TENS units, those type of things, as well as manual therapy, soft tissue mobilization, myofascial release techniques, you know, as well as using acupressure points and trigger point areas. And it's also important to instruct the patient in a therapeutic exercise program, such as stretching and strengthening exercises, and also using some of the pain gels. Some of the topical pain gels really help a lot.
And to talk more about that, we're going to come over to you now, and tell me a little bit about these pain gels and how they work.
Well, the good thing is with these topical or transdermal pain gels, we're actually able to, in theory, get past the first two layers of the skin where we can get systemic, and therefore we're passing first pass effect. So for a lot of those issues associated with non-steroidal anti-inflammatories, GI upset and potentially even GI bleed is one of the major side effects associated with that. With doing these transdermals, we're able to bypass that. Patients are able to get the relief without the necessary side effects. A lot of the different medications that we can use a host of different medications prescribed by a physician, non-steroidal anti-inflammatories being the main one, muscle relaxant, antispasmodics, along with local anesthetics. So really, based on patient-specific prescriptions from their physician, we can make a whole host of different things.
And it seems like, Dr. Rogers, it really is a team approach when it comes to pain management.
Right. I think we have something unique in that we have Ernie with 30 years experience, me with 30 years. I'm not going to prescribe narcotics. We've got Harshbarger, who's been making these pain gels for years. They're very effective. I use them. We've used them for years on our patients, and it's a very good way to come in and get evaluated for pain.
All right, well, certainly a very important topic that we're discussing today. For more information, you can come by their office here in Kingsport. You can always check out the website as well, performancemedicine.net.
The preceding portion of Daytime was sponsored by